In this podcast episode, Dr. Mike Israetel, an expert in sports science and recovery, shares valuable insights on optimizing recovery for athletes and active individuals. He delves into the analogy of machine maintenance to understand human fatigue, explores the key factors affecting recovery, such as sleep, nutrition, and stress management, and addresses common misconceptions about rest and recovery strategies. Recovery can be likened to machine maintenance, where humans are viewed as complex machines shaped by evolution. Just as machines undergo wear and tear during high-output performance, humans experience fatigue that alters their normal state. This fatigue can lead to microdamage in muscles, depletion of neurotransmitters, and hormonal imbalances. For optimal functioning, the human body thrives in a state of parasympathetic dominance, characterized by full glycogen stores and intact muscles and tendons. Fatigue can stem from various sources, with physical training being the most apparent. However, daily physical activity also plays a significant role in overall fatigue levels. Athletes who remain active outside of their training sessions may not realize that their overall activity can hinder recovery. Coaches often advise limiting physical activity outside of training to optimize recovery. Psychological stress is another major contributor to fatigue, as it can keep the nervous system in a sympathetic dominant state, preventing effective recovery. Chronic stress can lead to hormonal imbalances, negatively impacting performance and body composition. Thus, recovery is not solely about physical rest. It also involves managing psychological stress and ensuring the body is in a conducive state for healing. The human body possesses a remarkable ability to heal itself, but it requires specific conditions and nutrients to do so effectively. Recovery modalities should focus on reducing stress and allowing the body to enter a parasympathetic state, which is essential for effective recovery. When considering the factors contributing to fatigue, it is crucial to recognize that physical training, daily activity, and psychological stress all play significant roles. Coaches emphasize the importance of managing these factors, especially during critical training periods. Athletes must be aware of their overall activity levels and how they impact recovery. Recovery can be assessed through various methods, including performance metrics, soreness levels, and psychological readiness to train. Performance is the most reliable indicator of recovery. If an athlete can perform at or above their usual level, they are likely recovered. Soreness can provide insight into recovery status, but should be contextualized within the athlete's normal training routine. Additionally, the desire to train is an important factor. A lack of motivation can indicate overreaching or insufficient recovery. Cumulative fatigue is a critical concept in understanding recovery. Acute fatigue occurs immediately after exertion, while cumulative fatigue builds up over time due to insufficient recovery between training sessions. Athletes need to manage their training loads to prevent excessive cumulative fatigue, which can lead to underperformance. Regularly scheduled recovery periods, such as deload weeks, are essential for allowing the body to recover fully and reset. Several key strategies can be employed to reduce fatigue effectively. 1. Adequate sleep. Sleep is crucial for recovery, allowing the body to repair and regenerate. Israetel emphasizes the importance of aiming for 7 to 9 hours of sleep and ensuring the sleep environment is conducive to rest, such as maintaining a cool temperature and darkness. Aligning sleep patterns with circadian rhythms by going to bed and waking up at consistent times can significantly improve sleep quality. 2. Nutrition. Nutrition plays a vital role in recovery. Israetel highlights that insufficient caloric intake is a common mistake, particularly for athletes. While food quality matters, the quantity and macronutrient balance, carbohydrates, proteins, and fats, are more critical for recovery. Athletes should focus on consuming enough carbohydrates for energy replenishment and protein for muscle recovery, while also ensuring they consume enough fats to avoid cravings. Enjoying meals can enhance recovery, so athletes should not feel guilty about indulging occasionally. 3. Hydration. Hydration is essential for maintaining performance and aiding recovery. Proper fluid intake supports various physiological processes, including nutrient transport and temperature regulation. 4. Active recovery techniques. Active recovery techniques, such as light exercise or mobility work, can help facilitate recovery without adding significant stress to the body. These activities promote blood flow and can aid in the removal of metabolic waste products. Number 5. Psychological strategies for recovery. Psychological strategies, such as mindfulness and relaxation techniques, can also aid recovery by promoting a parasympathetic state. Reducing overall stress levels through lifestyle changes, such as limiting exposure to stressors and prioritizing leisure activities, can enhance recovery. 1. Most common sleep errors. Israetel identifies 3 major errors people make regarding sleep: insufficient sleep duration, poor sleep quality, and irregular sleep timing. He recommends aiming for 7 to 9 hours of sleep and ensuring the sleep environment is conducive to rest. Regularity in sleep timing is crucial, as erratic sleep schedules can lead to grogginess and decreased performance. Number 2. Misunderstanding rest. When it comes to rest, Israetel emphasizes that it should involve low-energy activities that genuinely promote relaxation. He warns against confusing fun, high-energy activities with true relaxation, as the latter can lead to increased fatigue rather than recovery. Ideal activities include leisurely walks, watching lighthearted TV shows, or spending time with friends in a low-key setting. Mental engagement in stressful or stimulating activities, even if they seem relaxing, can detract from the restorative benefits of rest. 3. Food-related mistakes. Israetel discusses common food-related mistakes, highlighting that the most significant issue is often insufficient caloric intake. He stresses the importance of consuming enough food to maintain body weight, particularly for athletes. While food quality matters, the quantity and macronutrient balance are more critical for recovery. Stress management involves both the avoidance of unnecessary stressors and the effective handling of unavoidable stress. Israetel emphasizes the importance of making conscious choices about stress exposure, such as avoiding traffic when possible. When faced with unavoidable stress, he suggests assessing what can be done about the situation. If action is possible, creating a to-do list can help. If not, acceptance of the situation and redirecting focus to something enjoyable or productive is essential. Maintaining a calm mindset and not letting external stressors dictate emotional responses is crucial. For individuals in high-stress environments, Israetel emphasizes the importance of recognizing when to pull back and prioritize recovery. High-achieving individuals may be prone to overworking themselves, so assessing fatigue levels is vital. Pushing harder is not always the solution. Instead, focusing on relaxation and recovery strategies can help maintain long-term productivity and well-being. Viewing oneself as a machine that requires maintenance advocates for a balanced approach that includes rest and recovery as essential components of performance. Israetel explains that while cardiovascular exercise can help reduce delayed-onset muscle soreness, DOMS, after intense workouts, it does not necessarily promote actual recovery of the muscles. Cardio can mute soreness, allowing individuals to return to their previous performance levels sooner, but it may interfere with the anabolic processes necessary for muscle growth. Recovery is more about allowing the body to heal and adapt rather than simply engaging in more activity. In discussing heart rate metrics, Israetel cautions against over-reliance on these numbers for determining recovery status. Heart rate variability and other heart rate metrics can be influenced by various factors and may not provide a complete picture of an individual's recovery state. Instead, a broader range of indicators, including sleep quality, stress levels, and overall physical preparedness, should be considered. Regarding stretching, while it can feel good and provide temporary relief, it does not significantly contribute to recovery. Stretching can cause microdamage to tissues, which requires its own recovery time, and should not be viewed as a primary recovery strategy. Israetel critiques the effectiveness of hot and cold therapies for recovery, explaining that these methods primarily serve to mask discomfort rather than promote actual healing. Cold exposure or contrast baths can reduce inflammation and provide immediate relief, but they do not facilitate the underlying repair mechanisms necessary for muscle recovery. The best approach to recovery involves allowing the body to go through its natural healing processes without interference from these therapies. Effective recovery is about doing less rather than more. The foundational elements of recovery include sleep, nutrition, and stress management. Recognizing fatigue levels and prioritizing relaxation and downtime are essential for recharging. Recovery encompasses not just physical rest, but also mental and emotional well-being. A holistic approach to recovery includes enjoyable activities, social interactions, and self-care practices.